Good afternoon. This is Dr. McCormick. Welcome to the Pulse of Healthcare. And today I'm sitting down with Tim from LASO Health. As you know, LASO is one of our telemedicine vendors. And what I'd like to do is just give Tim an opportunity to kind of describe LASO Health and say why it's so amazing. And, I can tell you that from somebody that's dealt with a lot of telemedicine, really since it was invented and came onto the market, that more and more people are seeking care through the telemedicine platform and finding telemedicine that not only delivers great direct primary care, but the other benefits that go along with that really set LASO up as unique in the space. Tim, why don't you tell us a little bit about LASO and what makes them different?
Sure. So, LASO Health is the vision of Dr. Mazzani in San Antonio. He's a nephrologist down there, and after 20 years in the healthcare system as a resident, as a fellow, as a practicing physician, as well as an employer, he has a very unique perspective on healthcare. And the biggest thing that he saw in all of that was the gatekeepers that prevented these barriers to care. So he dreamed of a system where doctors and patients, crazy enough, could do business directly with each other without insurance involved or otherwise. And that is what we set out to build. And I came on board about 4.5 years ago to help make that vision a reality. Through that process, we built an app with a network of physicians in San Antonio, Texas, and it's up over 230 physicians now. Everything from a $7 lab test all the way up to a bundled surgery. We can offer those now without the involvement in insurance. And then at July of 2022, got a call from Walmart. They had seen the app. They love it. Walmart is making big strides in healthcare. And they wanted to work with us. And what we did not have at that time was a telehealth component. So we told them that that's what we wanted to work with them on, that we wanted to use their network. However, we needed to present it in a way that was accessible to people. And so what we did is we created the concept of streaming healthcare. And what that really is that for this one low price, you can have access to virtual primary care, virtual urgent care, as well as virtual behavioral care for one low monthly price as much as you need it. So very similar to a Netflix or one of those memberships, ours is very similar. You pay month to month, and you receive these services on an unlimited basis. And what we have found is once people figure out how it works, they do utilize it. And I know for a long time they had it before COVID. Virtual healthcare was taking a while to come on, and now we realize through COVID the time was right for something like this. But more importantly, making it affordable and accessible. That was the big key. It's always been the key with Dr. Mazzani is that whatever we build, our POV, our point of view in this space is very simple. Transparency, convenience, and access. It's all the things that don't exist in our current healthcare system. And LASO Plus, which is our telehealth product, is a natural extension of that original vision.
That's awesome. And so, and we talk a lot about Ovation Health, which is our commercial-based plan. And people talk about how is it that you can deliver healthcare cheaper than, some of these big players? How do you do that? And so much of that has to do with partners like you that share our philosophy about transparent services and things like that. And you said a couple of things that were super, super critical, so I want to circle back to that. Direct access to the primary care doctor, direct access to mental health, unlimited use. And so what you see in a lot of these other marketplaces with other providers that are in the same space, because you go, well, why is LAFO different? Well, all of them will offer you care, and all of them will offer you a subscription streaming like Netflix. But then when you go to rent the movie or use the care, they want to come back and say, well, thank you, but now give us $50 more, or give us $75 more, or give us $100 more. Well, now what you've done is you've created another hurdle, another barrier between that member that needs service and the service that's provided. And so we're very philosophically aligned that we want no barrier. We want people to go in, engage in care, and get care. You have another component that's pretty cool too. Part of your deal is that through your partnership with Walmart, you can also get free or highly discounted subscriptions, RX there at the counter. And then you got another component that you can add to your plan. You know, if somebody knows that they're on maintenance medications and things like that and can go back and calculate that spend, you've got a way where they can kind of prepay for that and pay less. Talk about that a minute.
Yeah, thank you. That new program that we have is we've always had a really great discount RX card inside of our app, and we highly encourage our users to use it because it actually does work. But RX Zero is our newest product, and that is a formulary created by Dr. Mazzani, our founder, working with several providers. We got this consortium together, if you will. But what it is a program for $24.99 a month on our consumer pricing. You have access, $0 access to over, it's 600 drugs exactly, actually, shipped free to your home. And the best part is, you know, you mentioned barriers, and that's been the commitment from the beginning, is that we need to remove the barriers to care, because truth of the matter is that 60% of people in this country will defer care just on cost uncertainty alone. Well, by providing an all-inclusive membership, what we've done is we've removed at least one barrier to this. And with RX Zero, I was personally customer number one. And yes, everybody loves their baby, but I'm always looking for the problems in the baby. And it was flawless. You know, it took me 2 minutes to, as a new user, download the app and sign up and push the payment through. And once that happened, I immediately hit the button, got on the phone with the U.S.-based care representative, LASO representative, and they took all of my medications down, my information. They were the ones that called my doctor to transfer the prescriptions. I didn't have to lift a finger, and about 3 days later, I had the medications at my home in my mailbox.
And you said 90 days worth, right?
90 days worth. If your doctor will prescribe it, they'll fulfill it. But it can be 30 or 60 or 90, but 90 days is most convenient. And what we're talking about now is that we have this great option for maintenance drugs. And believe it or not, 5% of the U.S. population is on over 10 medications.
It's really insane.
It is. And we have some customers at this time that have 15 and 20 medications. And the savings that they're seeing, and Dr. Mazzani tells the story because as a nephrologist in San Antonio, Bexar County has one of the highest rates of diabetes. We are the highest rate of amputations in the nation. Many of the people he's working with are very underserved populations, will literally cry when he showed them this product because they were making choices between food and medication. And one woman had lost her insurance, her meds were going to be $300 a month, and now it's $25. And that's life changing for a lot of people. So everything that LASO does and every partnership that we create has to embody those three things, which is, again, transparency, convenience, and access. But most importantly, it empowers them. But by removing things like visit fees that you see in other platforms, those things look like copays to people. And when people pay a copay, what they know is there's another bill coming. And that's why people don't go to the doctor in this country. We've eliminated that. There is absolutely no commitment, no barrier. Once you've paid for the service, you use the service, but you never have to worry about that next bill.
That's awesome. Yeah. We are so excited at Ovation to not only partner with LASO for our commercial plan and be able to embed that as part of our core services, but also in some of our subscription-based plans. So we're looking forward to some exciting new products that we're able to talk about today that hopefully we'll see in 2024. Yeah. And we are so glad that you were able to come down and visit with us today, and we appreciate it.
We appreciate you, Dr. John, because you're leading the way and you're bringing together really good people to solve healthcare in a real way. Government, they've already got their solution. We've seen what it's done to us. And like I said the other day, when you lose Elizabeth Warren on our healthcare law, you've lost everybody. So,
what did Reagan say? The scariest words are, "I'm from the government and I'm here to help."
Exactly.
we know.
Yeah. So it's up to all of us to do it from the ground up. So that's what we're doing here today.
Absolutely. Well, thanks again for another episode of The Pulse of Healthcare, and we'll talk to you next time. Thank you.